and welcome to our next conference session, From Community Development to Good Health, Ageism is in the Way. My name is Becca Bolas, and I'll be moderating today's sessions. A few reminders before I introduce our speakers. The first is that we are offering conference captioning services. You should be able to see this underneath the screen with the PowerPoint presentation. And if you don't want captioning services, you can push the pause stop button to stop the screen. And just a reminder to please complete the session evaluation. Just 4 short questions, and your feedback is very helpful to us, and it is required if you're seeking continuing education credits. So with that, I am now excited to introduce our speakers, Jess Maurer from the Maine Council on Aging and Harden from Catholic Charities, Maine. Take it away, Jess and Don.
Excellent. Thanks so much for having us. We're really excited to speak with you all today. And so this presentation is part of our Power and Aging project, which we launched in January and is funded by the Maine Community Foundation. And we're about to be 10 years old, the Maine Council on Aging. And I have to say that before 2020, we weren't really talking about ageism, at least not head on. COVID really hit us over the head with a clear message that we need to stop doing the same thing over and over again and expecting different results. Over ageism that we saw during COVID and we continue to see really spurred us to action to begin addressing ageism across multiple systems. We believe this is really the most important thing we can be doing to be able to build healthy, inclusive communities and support the kinds of support that will work for people of all ages. Our formula is pretty simple. It is that we know ageism is bad for us, it's bad for our systems, it's bad for our economy. Most importantly, ageism results in less support for the kinds of changes that we need to support healthy aging. We also know that when people understand their own age bias, and this is a spoiler alert, we all have age bias, that they're less likely to act on that age bias. We also know ultimately that having direct conversations about age bias that impacts us and our system leads to positive individual change and more support for systemic change. We always start our conversations with a look at Maine's demographic. People 50 and older make up 54% of Maine's adult population. And we tend to think about them or talk about them in one giant lump, as if all the people in Maine who are 50 and older are the same and have the same needs. And we've really learned that it's important to disaggregate who we're talking about when we're starting to talk about older people in our community. People who are 50 to 64 or are having significantly different challenges, specifically with employment discrimination or their inability to access insurance, as opposed to people who are 80 and older, who can be experiencing significant challenges with accessing transportation, finding housing that works for them, and certainly in finding care that they need. So our big question for discussion today is, can we build a more equitable and inclusive Maine with healthier people and communities and a stronger economy by intentionally addressing age bias in all its forms? Or put another way, what's holding us back from living our best lives long into old age, seeing older people as valuable contributors to our economy and society, and making investments in our community and state budget that support healthy aging? What's keeping us from seeing the whole person, not a person in need, not a frail, vulnerable person, but a person with long-lived experience who continues to contribute to society in a multitude of ways? We have no question that the answer to this question is ageism. I'll turn things over to Don now for a bit to talk more about what this is all about.
Thanks. No, I'm sorry, next slide.
Yeah.
So here's the global view on ageism across societies. It's pervasive, it's everywhere. It's like the air around us, invisible, often unnoticed, but we're always breathing it in. The World Health Organization considered it such an important public health concern that they undertook and released a study on ageism and an action plan. And ultimately concluded that it's one of the most important and neglected social determinants of health. Slide, please. So keeping that visual a few minutes ago of ageism in your mind. We have found from doing these conversations and presentations, it's important to engage our participants early on in our presentations. And we learn so much more from people sharing personal experience and how, whether you've experienced ageism, witnessed it. So we'd like to take a few moments to have you chat on what words or phrases come to your mind to describe ageism and its impacts. And Becca's going to help us by sharing some of the more, some of the chats that come in. So just take a few moments and chat what words or phrases come to your mind to describe ageism and its impacts. Yeah, okay.
We see short-sighted, invisible, isolation, inefficient, hurtful, excluding from community rather than recognizing how they can help community, depression, unfair, missed opportunities. A lot of engagement here.
Yeah. Well, thank you very much for sharing. And maybe we can move on to the next slide, please. Because you've highlighted lots of things that people share when we ask them, what is their experience of ageism? So we've taken this complex topic of ageism and we've got it down to one page here. Here's a visual of what ageism is and the 4 levels it operates across. So ageism is age-related bias, and a lot of people have indicated that ageism might be the last acceptable bias in our society, and it shows up across 4 levels. So, for example, you see internalized ageism. So think about the person who would benefit with their mental health and their social health by volunteering, or physically would benefit from continuing to go to yoga, but they make the decision that they're too old. Interpersonal ageism, where there's a bank customer or a patient standing in front of you with their son, and you turn to the son rather than getting the story from the older person right in front of you. Institutional ageism in a workplace where people refuse to interview people over a certain age because they feel they're incompetent with technology. And then there's systemic ageism, which is really about how we distribute our resources, the decisions we make locally in Washington and in Augusta, and the cultural messages that we get bombarded, which send messaging about what it means to get older. Jess, please, the next slide. So we all live with this kind of public messaging, the commercials, that there's something wrong with turning older, something to resist. Imagine 50, which is basically dead. And then somebody chatted invisible. The next slide, please. The invisibility of ageism. Ageism is pervasive, but at the same time, it's invisible. I think it's divine intervention that our Power and Aging Project actually chose the symbol of a sun to sort of be the logo for our project. It really speaks to the invisibility of ageism and our task of bringing ageism out of the darkness and shining light on it. But these are 2 visuals from 2 very high-minded organizations, one on domestic violence. And is the message here that domestic violence does not happen with people that are older? And is the message on the right that everybody is welcomed, but older people? And another example of invisibility that we're finding a lot about is that at a time where people are much more sensitive about developing diversity, equity, inclusion programs in workplaces, we're finding that age and ageism is not included. It's significant that in 2017, the National Society for Human Resource Management found that only 8% of organizations and businesses include age and ageism in their DEI programming. And we're finding that to be the case locally as well. So we could have had a graphic which says, we're proud of our DEI program, but it would not list age. And in terms of cultural messaging, what about the value of aging during a health crisis, the expendability of older people that we experience so viscerally during the pandemic? Next slide. So ageism has significant impacts on health and well-being of older people, and already mentioned in the workplace, certainly in healthcare, the poor health outcomes, and as Jess mentioned, in policy arenas, where funding decisions are made in which there is a lack of access for older people to services oftentimes. So next slide, please. And one of the areas that is quite significant is ageism in healthcare, overtreatment, undertreatment, elder speak, not seeing the whole person, not hearing the whole story. And it's significant, once again, that the World Health Organization found that in 96% of the studies conducted that ageism was associated with worse outcomes in all of the health domains examined. And that's not just ageism from the practitioner, it's also internalized ageism that we're talking about. It's also expensive. The World Health Organization also talked about a study in the US where they found that 1 out of every $7 spent on the 8 most expensive health issues were due to ageism. Next slide, please. So there's ageism in healthcare and there's ageism in health. And so once again, the ageist beliefs that people hold themselves and not focusing in on healthy aging, the things that you can do every day to age well. And the kind of the internalized negative stereotypes about I'm too old to do this or I can't do this, versus the attitudinal positive attitudes about aging. We know that people live longer if they have positive attitudes about aging. Next slide, please. And of great significance in terms of examples of the impact of ageism, we look at how ageism works in our economy, in our workforce. One of the reasons that Maine is the oldest state in the country is because we have such a low birth rate. We literally have very few young people in our state relative to our aging population. So that is certainly made for a significant structural imbalance in our workforce. If you look at the amount of people that are entering the workforce versus the amount of people that are leaving the workforce, we're looking at a substantial gap, over 100,000 workers in a total labor force of 700,000. That's a significant problem. But ageism only sees the problem, whereas age positive sees the opportunity. The biggest demographic cohort available for recruitment, retention, or return to the workforce are the people over 50. That was identified over 8 years ago by the Maine Development Foundation in a study that they did, a report they did on workforce quantity. And once again, they looked at the buckets of opportunity that employers could recruit from. And they found that older people provided the greatest opportunity because they make up the big demographic numbers. So their recommendation was if we could just increase workforce participation in that group alone, we would make a substantial impact on the workforce shortage. Thank you. Next one. Yeah. So once again, we say what's holding us back? I mean, why aren't older workers a key part of our workforce development strategy? The business case is compelling. It's both the demographics And it's also the value that they have in terms of their experience and their ability to add so much to the workforce. But at the same time, we see things like the AARP survey, which found that 78% of older workers witness or experience ageism, age discrimination in the workforce. And recently, the Maine Department of Labor did a study about who are those people that are sitting at home unemployed. And they found that for people over 50, 25% of them said that the barrier for them going back to work is age discrimination. So it is these unproductive and inaccurate stereotypes about aging. But the solutions are relatively simple. Understand age bias and how it operates in the workplace. Be intentional about best practice around recruiting and retaining older workers. We know how to do this. It's just our views on the value of older workers. And Jess, I think I'm back to you. Thank you.
Thanks, Don. So thankfully, we have some great tools to help us think about how do we address ageism and change the conversation about aging. That's thanks to a group of national organizations and funders who got together to fund Frameworks Institute to do extensive empirical research on these questions. What do Americans think about aging and older people, and how can we help them move away from their unproductive thinking? Not surprising to us, when we actually saw this research, this is what Americans think. They have this idea that older people are either on their yacht or skiing or golfing, or they have one foot in the grave, and there's pretty much nothing in between. Also, and the focus groups are really fascinating. When you talk about ageism, folks say that's not real. Well, if it is real, you know, it's not as bad as the other isms. It's not as bad as racism or sexism or homophobia. They also consider, and by the way, this is definitely an internal ageism as well as an external ageism issue. They consider aging to be an individual issue or an individual challenge or problem to be solved by the individual, and not a systemic problem. And I hear this at the legislature all the time. In my day, the family used to take care of old people. And by the way, the family, read women, used to take care of old people. And that's this idea that if we're coming to them asking for more funding for X, Y, or Z, that there's somebody else, it's somebody else's responsibility to take care of this, when in reality, these are systemic challenges. None of us can solve the workforce challenges that we're experiencing. None of us can build affordable housing. None of us can fix our public transit challenges. These are all challenges that are systemic and need a systemic response based on the new needs of older people as we are living longer lives. And then finally, you know, the things that for decades now we've been hearing about, the silver tsunami, and you know, the way Social Security is going to rob millennials of any sort of semblance. Even right now, there's a lot around climate issues that older people are responsible for our current climate challenge, and are robbing our young people. So there's a lot of us versus them thinking and fueling some of these ageist beliefs. The last piece we really like to underscore is that in fact, the words senior and elder and senior citizen are associated with the least competent and oldest among us. And the term older person or older people are considered, you know, sort of on the younger demographic. The piece here that's really important is, well, I'll talk about that in 1 second. So the takeaway from this research for us is multifold. One is that we use inclusive language. Everyone is aging, so we've stopped talking about doing something for older people, and have really shifted our personal language to say we're making sure we can all live healthy, engaged, secure lives as we age in our homes and communities. We've also started encouraging people to embrace their age. If we could all be proud of the wisdom we're accumulating over the years and live our ages out loud, including some of the challenges that come with aging, we'd all have a more holistic view of older people and what it's like to age. This gets back to the other slide, and it's really important. If you take away nothing else, this is the one. Seniors are someone older than you, and that's the least competent, oldest among us. And if you're talking to somebody about a program for seniors to a 70-year-old, they're thinking about their 90-year-old mom, and that's what that program is for. So when you're talking about services for people or anything in relation to aging and older people, we encourage you to be specific. If a service is for somebody who's 60 and older, then say it. Say this is a service for somebody who's 60 and older. If you feel the need to describe older people using a term, then use the term older people. It helps people see themselves in the technology. So this is the second spoiler alert. When we ask older people, and actually younger and older people together, what would you like to be called in the third part of your life? The reality is it's none of the above. Nobody really likes any of the labels that have been offered thus far. So it leads me to believe that we need to find a new one. And if you wouldn't call lower income people the poor, or people who are challenged with disabilities, the disabled, we encourage you to never use the term the elderly again. And if you've met one old person, you've met one old person. We also encourage you to avoid defaulting the extremes in relation to aging. We're not all thriving and we're not all failing. I like to say often 1 in 4 of us will need a year's worth of care for the rest of our life, and 75% of us won't. But that doesn't mean that 75% won't need some services that are intentionally designed to help them live in the community. So the good news is conversations work. We've been having conversations with HR directors, employers, healthcare, and the media. And we offer this. We met with Portland Press Herald editorial staff in early January, and Greg Kasich actually took a look at that picture of the lieutenant governor in Texas saying that grandparents would be happy to die so that we could reopen the economy. He said, do you really think, normal Americans hold that view? And I said, well, I've been in many, many rooms where I've asked people to describe what the perfect community is to age in, and folks do this great job of, walkability and services and all these things. And then it comes to the punchline, which is when I can't do for myself, somebody's going to take me out behind the barn and shoot me. And people laugh. And it is, in fact, as he says, a grim joke, but it is very much a judgment on how older people are living in nursing homes and in assisted living facilities. And if we don't want that for ourselves so much that we would rather somebody kill us, then we really don't value the lives that folks are living. And that had an impact such on Greg that literally 3 days later, he wrote this editorial. And we found, thankfully, that having these conversations really do work. Shifting is also really easy. Once we see age bias, we can actually reimagine the ways that we might want to think about talking and sharing images about older people. Intention matters, and that's sort of the last part of this presentation, is really that it's important to know that, we have long since known that it's critically important that every child in Maine, particularly because, as Don said, we have such a low birth rate, every baby born in Maine has to grow up ready and able, healthy, good brain development, ready and able to take, the jobs of Maine's future. But we have to be equally as intentional about ensuring that older people in Maine are living the best lives that they can, that they have access to what they need to keep them working, creating, mentoring, governing, and we have to be really intentional about this. The nice part is that we have an incredible opportunity in Maine to align our thinking and our expenditures to benefit everyone, and to make sure that it's sort of good for both ends of the continuum and in the middle. So I wanted to spend a little bit of time when talking about intention is to say that we need to understand what older people need. And as I mentioned earlier, that's different for a lot of different older people. And sometimes that means we have to look beyond county data to know how people are doing in any one community. As you can see here, more than 60% of households in Eastport have a person living in it with, who is over 60, which is drastically different from South Portland. This is why we launched the Municipal Data Across Sectors for Healthy Aging initiative, we call it MDASH, in May of 2020. Our hypothesis of this project is that municipal officials with proper data and support can collaborate with health systems, social service providers, payers, and volunteer groups to improve the health and social health needs of older people. In this project, we have a keen focus on income, because one of the false assumptions we have is that older people are doing okay because we have a relatively low poverty rate among older people. And of course, that's because of Social Security. What we don't know is that a third of older Mainers live on Social Security alone, with an average Social Security of about $16,000. We look to the Elder Economic Security Index to help us tell a story about the financial status of older people in communities. This index looks at what a person needs, a person over the age of 60 needs to have to live on if they rent or if they own, if they own with a mortgage or without a mortgage, and how their health is, whether it's poor, good, or excellent. This slide is for a couple living in a home that they own with no mortgage and in good health. By our estimate, about 26% of older Mainers don't have enough money to meet their basic needs, which means they do without. They do without heat, they do without food, they do without prescription drugs, they do without repairing their home or without repairing their cars. I want to walk you through a few slides that go just a little bit deeper into the data that we're seeing. And this slide tells an interesting story. 18% of older people in South Portland live at, oh, these are people over the age of 65, sorry. 18% of people over the age of 65 in South Portland live at or below 25% of the median income. Eastport has twice as many older people living in poverty than the state average, with a high retirement income. This is showing, and we have, this is the great part about this project, because we asked the question, what the heck is going on there? And we've learned that a ton of folks have moved to Eastport. Actually, these are not, historical families that have summered there for 200 years. These are people from Silicon Valley who are retiring to Eastport and still working and bringing with them a pretty significant retirement income. And so it tells a real story of the haves and have-nots, and some of the challenges that we'll be trying to solve through this project. It also will show you that at the last slide is that in Gray and in South Portland, the folks, a quarter of the folks who are living in poverty are women who are over the age of 65. So we'll go just a little bit deeper on that issue in just 1 minute. So one of the surprising data points that we found in Gray is that they have far fewer people over the age of 80 than other communities in Maine, whereas Hallowell has nearly twice as many as the average. This makes us question what makes one community more inhospitable for a person to live who is 80 and older versus another community that obviously is more welcoming. This is where I get to say again, without intention, we don't know what we're missing. And I get to tell you a story about Bob. So this is Bob. He's, I think he's 81 now. That photo of him was taken when he was 79. And I live in Harpswell and helped create this thing, Harpswell Aging at Home. And Bob, he's a retired nuclear engineer. He kept us all safe as nuclear energy was being developed in the country and in the world. And he retired to Harpswell, and his like main objective in the world was to create a home repair program, a volunteer home repair program for older people. And we did it. We helped him create it. And he went from 6 guys to 26 guys. And his deal was, I want to repair 25 homes a year in Harpswell. And he's exceeded that goal every single year. Saved lives, documented saved lives. and made it possible for older people here in Harpswell to stay in their community by simply doing home repair work that makes their homes safer, warmer, and drier. Well, Bob has a neurological problem, and his brother does too. It's genetic, and it makes him to get dizzy, and he falls. And so they couldn't continue to live in a two-story home. And he and his wife, and he couldn't take care of the yard anymore. He needed a one-story home with a very small piece of land to take care of. And he and his wife looked in Harpswell for an entire year and couldn't find anything. And so they left our community. And so this is the question, right, that I have. We make assumptions about who 80-year-olds are and what they mean to our community and why it is we need to be intentional about the value. We don't know what we're missing when older people leave our communities because they don't work for older people. There are workers still, our volunteers, our civic leaders, our grandparents, our artists, our friends. They're the fabric of our community. And we must be intentional about how we plan our communities to meet the new needs, all of our new needs in later life. So this leads to my last point, and then we'll stop and take some questions, is that gender is really important in this conversation. You'll see that 2/3 of older people living alone in Maine are women. This means they have less access to informal supports than those people who are living with other people. That means that they're more likely to have to pay out of pocket for things like transportation, handyman services, and care. Not surprisingly, historical bias leads to the reality that older women living alone have less income than older men living alone. And in some communities, there's a significantly wider gap. Finally, here are some steps, a few action steps you can take or motivate others to take. If you're motivated, you can also visit our Power and Aging website, our Power and Aging page on our website, where you will find a couple of action guides that talk about language, that talk about actions you can take. You can also sign up for our anti-ageism pledge. You can take the anti-ageism pledge. Don and I have both taken that pledge. And you could actually find an email for Don to ask for a power lunch. We're hosting conversations like this for half an hour for organizations all across Maine, and are finding, as I said before, the conversation is the most important thing we can do. So now I'm done. I think Don's done. So we'll stop and we'll take any questions you might have.
Great, thank you both so much. You covered a lot in a short period of time. So I will just ask people, if you do have questions, please use the Q&A feature. There are a few that have come in, so I'll start with those and then see if any others trickle in. So the first question is if there are any self-assessment tools that people can use to learn about our own age bias.
That's super interesting. I don't know of any. Don, do you? You're muted.
You have to unmute, Don.
He's having a hard time unmuting. Hit the space bar. Try that.
I think you have to hold it down.
Oh, there you go.
There we go.
Oh, now you lost it again. There you go.
I'm going to keep my hand on the space bar. So the question was assessment tools.
Are there self-assessment tools to sort of understand your own implicit bias? There's the Harvard implicit bias test. That's right, of course. See, I should have thought about that. Do you want to talk about that, Don?
Well, as Jess was saying, there is the Harvard implicit bias test, which can reflect your implicit bias on a whole range of areas. But we do encourage people to take that. I know it's a real eye-opener for me to take it, and we can send that link out somehow. Because I learned that even though I'm 71, I have almost 100-year-old mother, and I work in the aging field, that I'm sort of attracted to young. I prefer young over old. So that was an interesting thing. It doesn't, I mean, the point is that we all have bias about everything, but it's what we do in response to that awareness is the important thing. There are a lot of also obviously assessment tools for employers, for example. to really detect if they're an age positive, age friendly employer. So there are things out there. A lot of it is just getting the traction to use what's out there.
That's great. Thank you very much. And Lisa Dunning noted in the chat that AARP has a quiz also on their site
Cool.
as well. So just adding that.
Of course, Lisa Dunning would know that.
Right. True. They do. Yes. And we
Are
usually
there?
recommend that.
Oh, I'm sorry, Don.
We usually tell people that. So
Are there any studies on how ageism interacts with the other isms and the impacts on health?
I am certain that there are. What I will tell you is that I've read a lot about intersectionality and privilege, and age doesn't show up a lot. So that is one of the challenges. I would have to look specifically to see if there is, something, a study. Do you know, Don?
I don't. But I think at the same time, we've also appreciate that there's a lot of things about ageism that haven't been studied. And that's probably another one that probably could use some good research. So,
for example, we were doing a presentation a couple of weeks ago for a bank, and I wanted to look at the impact of ageism on the customer's perspective, and all I could find at all was from then sort of discrimination in the workplace. It really hasn't been studied whether customers take their money and go someplace else if they're if they experience age bias in a business.
Yeah, I mean, it's significant that once again, and would certainly encourage everybody to read the World Health Organization study on ageism and the action plan. But in the action steps, that's one of the 3 action steps, which is research, research, research.
There's a lot of questions coming in, so I've tried to follow them. Okay, how are you currently collecting data about the interests and concerns of older adults?
If we're talking about here in Maine, it varies widely. So we have a state plan on aging that happens every 4 years, and for that there is a needs assessment. And so actually Muskie just completed a multi-person survey, and that's published on the Office of Aging Disability Services website, and focus groups, and very specific conversations with others. I think it's, it's like everything else, it's pretty fragmented. Maine is home. There's lots of good news in some of these conversations. Of course, Maine's home to about 130 communities that are doing some sort of aging in community initiative. And most of those communities have done some sort of an informal survey of needs of people in their community. And those surveys are really terrific because they often ask people like, what's good about our community and what's challenging about our community? What helps you live here? What would you need to continue to live here? How much do you want to live here? What do you need help with? Those sorts of things. And so there's everything in between. Obviously, actually, the community health needs assessment, China, we just hosted a conversation last week on the needs of people 65 and older, and we sure got a lot of really good input and ideas. So I think it totally depends on what you're talking about. There have been a number of caregiver studies. It's different in relation to what we're talking about.
Yeah, that's helpful because, on your last slide, I think you had a point about disaggregating data. And just with my researcher hat on, I wondered what some of the barriers are, just as a follow-up question to that, the barriers to collecting data and to being able to do that disaggregation. It's not easy. And so just, I guess, more of a comment, Jess. I don't know if that's really a question, just an observation.
It's not easy, and it goes back to this individuality. The conversation I had before was about our workforce shortage, and that was one of the things that came up in the China needs assessment, is that we really need to be measuring not just the wait lists for services or the inability of older people to get services, but what the impact is. We don't have any idea. We know people are dying and we have actual proof and stories, but we don't have a mechanism to collect that, and it's definitely challenging. And then you get into race, and I've done the math, the demographic math on the races that are published through the census, and the numbers are really small, particularly with Black and African American folks. There aren't a ton of folks over the age of 65. So the populations that show up more are Asian and Native. And so, once you start carving down, it gets smaller and smaller.
Yeah, and this conversation too is making me think the equity subcommittee for the Maine Climate Council just finished reviewing the climate action plan, and they have our draft recommendations are out. And I don't know off the top of my head who on the equity subcommittee represents working with older adults. And so when I think about the implicit bias and not always having that lens at the forefront, it's entirely possible that we missed opportunities in those draft recommendations. So maybe Jess, you and I can meet separately to talk about that, because maybe there are some missed opportunities in that draft list of recommendations that could be improved.
Absolutely. I'm sure there are. That would be great. Yeah.
We have a couple more questions. So one question is, you had mentioned earlier aging positive. And so the question is related to that. Do you find, or do you focus on aging positive, or are there terms that maybe were intended to be age positive and now they're not? How do people kind of, even if they recognize that they have an implicit bias and they're trying to correct that, are there steps they can take or pay more attention to certain types of language that can help them be more mindful about that?
Don, you want to take that?
Well, I was going to say, Jess had mentioned that we do have 2 action guides, which are helpful, I guess you could say, prompts, and about the language part of it. I think it's important not to obviously judge people that are moving in that direction, age positive. This is our work, right? So this is daily work, dealing with our own bias and taking steps. And it's evolutionary, not revolutionary, right? So.
Right. I think, for those of us who are digging deep on equity issues, right, we have to check our own bias. We have to talk about our culture. What is our culture? How do we operate? How do we operate from a place of privilege? And how can we operate from a different place? How can we be more inclusive? And how can we build a culture that supports a diverse group of people engaging with us, whoever we are, whether we're, an organization, a community, whatever we're doing in that work. And so I will just say, this is what Don just said: to build an age positive culture, we actually have to be inquisitive, so that whoever asked the question about how are you getting data about input about what older people need, that's it's an important place to start, which is like, how do we genuinely involve older people with lived experience in processes, and how do we seek them out? And then, we're in this double bind. How do we help people who we seek out to engage to see their own age bias in relation to how, because we can be just as judgmental and ageist as an old person against somebody else who should have been living differently, right? These are the unproductive messages. So it's sort of like we have a lot of work to do in helping people see this. But you know, we do have to at some point have conversations, for instance, in our comprehensive planning process about we need to be asking some very specific questions about what, you know, what would it mean? What would happen for you to not be able to continue to live in this community as an older person? And we need to like figure out how to ask the question in the right way so that people can start to genuinely say, not what's happening right now, but what they fear. So like, I know if I live in Harpswell, I can't drive anymore. I can't continue to live in Harpswell. And so those conversations are critically important for then a municipality to hear so that they can think about how do I begin to think about delivering public transit service to my community in a rural community. I'm going to stop there.
Yeah, I think it's such a big part of it is like we are all aging, getting that we're all experiencing the same thing. That's one thing that we will all do. We will all get older. We will all die. So it's that whole thing of being inclusive attitudinally and the shared experience of getting older.
Yeah, and just building off of that a little bit, Jess, with what you were saying, before your presentation, Jim Tassi from the Bicycle Coalition of Maine presented, and he was talking about streetscapes and how to construct or support a built environment that supports safe physical activity. And with the question you were talking about with the comprehensive planning, you know, what would it take for you to stay in your community? I mean, certainly one aspect of that is feeling safe, leaving home and being able to walk down the sidewalk or you know, go out of your home to run your errands. And so thinking about the built environment and investments in walkability and other, you know, interventions like that is certainly, you know, one part of this. Just kind of came to mind as you were talking.
Absolutely. And Jim and I have sat on committees together. I mean, we're a couple of different ones. And the built environment is critically important. I mean, it's basic. I mean, there's some really basic stuff. Complete Streets is great. But, you know, we've seen like in the city of Saco where, oh, and Saco, by the way, is great. I am not dishing on Saco at all. They're so amazing. But, you know, there's an affordable housing project for, you know, older people, and the bus stop is, you know, over 4 lanes of traffic with no crosswalk to it, you know, and no safety. So like these are the things that are basically we do need to be looking at how do we change our communities. But even as funny as it seems, like older people have different needs in relation to recreating. And there's, you know, we're going to be talking to the Parks and Rec Association in just a couple weeks, or even Monday. I can't remember, but Monday, there you go. But there's a difference between being ADA compliant and being friendly for older people, because a lot of older people may need benches, you know, periodically. They may need hand railings. They may need different kinds of parking. Men with prostate challenges need bathrooms. And these are all things like that stop people from using a public trail, if, you know, that they otherwise would if there was a place for them to sit down once they walked, you know, a quarter of a mile. And so these are all just issues that we need to just keep working through. And this is like a great, there are some really good auditing tools for communities for things like that. And that's a great way to build some intergenerational things. You know, you can get some older people and younger people together, maybe some people with disabilities, and, you know, send them out to trails in your community to see, you know, like how user-friendly are these for different groups of people, and then start making changes. I mean, this is like, these are small and large things we can do.
Yeah, there was a question about the intergenerational aspect, and that there can be programs that can be helpful for combating ageism. And I think you just brought up a great example of one, doing a built environment audit or a community audit. Are there any other programs that you think in Maine are a good example of those types of programs?
I think there, you know, we have some intergenerational community centers in Maine that have been really effective. And some, I'm trying to think now, we have a very, I mean, there's a couple, there's a assisted living facility in Gorham that couples, and I think they have a few couples with a childcare facility that apparently is wildly popular for both the older people and the families who go to that. I mean, I think there are a number of intergenerational programming. We don't do it that well, I'll tell you. And I think we're challenged again in my own community, where we have all kinds of programs that are helping older people. It constantly comes up, like, how do we engage younger people from the Harpswell Coastal Academy? The stupid liability issue just keeps coming up, honestly. So I think sometimes we're challenged. We're our own worst enemy in relation to that.
I was going to say the educational institutions in Maine, I think, are trying to do more with intergenerational programs. Like, I'm a legacy scholar at the Center for Excellence in Aging and Health at UNE. So there's definitely some pairing going on between students and older people to understand how best to converse with them, how to interview them, how to work with them in both research and healthcare. But definitely intergenerational is one of the few things that have been identified by research to impact ageism. So it's very important. And I would just go back to the last conversation. I know, looking at my mother, her social isolation is addressed if she can move around in her environment, her neighborhood. That's how intergenerational works naturally, is for people to be able to move around.
Yeah, absolutely. And I mean, and that also just helps, I imagine, feel connected, to your community and what's going on. And yeah.
Yeah, I mean, I'll just say, ageism rearing its ugly head again. I mean, what we have typically done, and here's the difference. Here's the built environment in ageism. What we've typically done with older people who need care is, like, we house them outside of a community, in a nursing home. There's no interaction with kids. And then you take a project like, Avesta's down in South Berwick or Berwick, I can't remember which one it was. They, like, literally took an empty parking lot that was next to a school and the library and walkable to, pharmacies and restaurants, and they plunked a affordable housing unit for older people there. And it's completely embedding older people in a community, as opposed to sending them 5 miles outside of town because it's the cheapest place. We've got a piece of land where we want to develop something.
Yeah, that approach to development is terrible.
It's terrible.
You see it with housing, you see it with schools. It's for everything you just said. I mean, the embedding in the community and being able to walk or bike or however else, not to rely on your car,
right,
or another mode of transportation. It's that's a really great example. I'm really glad you shared that, because that's also good to know that maybe their pendulum swinging back the other way to recognizing it's really valuable to be in the center of a community. There is another question here. On your Power and Aging page, one of the ways to get involved is to join with the team to facilitate or host a conversation over the next year. What does that entail? Tell us more about that.
Well, it entails sending your name in. That's the first thing. And then as somebody who has sort of received those inquiries, I always like to know, what people's particular interests are, because we've developed, for example, fairly generic Ageism 101 type power lunches. We've started doing workplace ageism in workplace power, age positive workplace kind of stuff. We're working on the ageism in healthcare. So a lot of that too is some people have particular interests. So understanding that. And then it is a volunteer situation, although we do have some stipends for people that are, let's say, are on fixed income or not working or whatever. And it's really about, deploying people. We always partner people up with somebody experienced. Try to provide the presentation. So it's not like you have to make up the presentation. It's more delivering the presentation. And a lot of the volunteer facilitators are people that have a lot of value in terms of both their passion about this and also sharing their own experiences. So, but the simple thing is to send me an email and I'll follow up with you.
And there's a little training, obviously.
Yeah. Yeah.
That's great. Thank you.
Yeah.
I think we have time for one more question. And this one's about technology and social media, and then thinking about the ageism in the workplace and hiring practices. Do you see an intersection there? And how have you seen examples of employers that have developed strategies with something that could be a barrier like technology? I mean, and just talking, I guess, a little bit more about those types of potential barriers that exist, even for an employer that is actively looking to hire older adults.
So I'll just say that sort of, and I'm not saying this in any offensive way, but sort of the question begs the answer that there's already there's already an assumption there that older people don't use technology, which is just not true. I like to say I'm 55. I'm not, I'm the younger side of the older world, but I mean, I grew up in technology. I mean, I've learned every new technology as it's come out, and so I think this is just kind of funny that we just have this blanket assumption that older people don't use technology or can't like sort of keep up with it in a way. And so there's the assumption, and then there is the thing that keeps, so people don't, Don and I just did a presentation to HR directors. These were high-powered folks. We both went into 2 different meetings and heard human resources folks happily, not happily, they told us that their senior folks were not even interviewing people who are older because they believed they wouldn't be able to use technology. So there's the first barrier, is even getting over that. And then this person told the story how they did hire somebody and they made the training longer. And there was, sort of a period of mentoring and she said, but I don't think my boss will do that again because it was too much work. And I, of course, said, hey, don't you think every employee would benefit from going through that kind of, sort of longer process, a longer integrated process? But I think mostly, we're, and certainly I do want to say DOL has some really good technology retraining for folks just generally. So if folks want to do that, Don, I don't know if you want to offer anything.
No, I mean, I just would second what you said. I mean, basically, it's understanding that in some ways we all need types of accommodations, all of us across the whole age range, and so yeah, it's not a given that somebody as they get older can't manage technology, and that we have to do special programming for that population based on age. And I certainly during the pandemic, we learned that older people do pretty well with technology because we had to shift everything to telephonic and online, and it actually worked pretty well. The digital divide around access to technology, we learned, is a bigger problem than people's capacity to do it. So
I think, Don, I'll just underscore Don's point right there is we all come to our jobs with needing to learn different things. We younger people, of course, is there's ageism against younger people, may need some training in relation to professionalism or customer service, or sort of different things that an older person comes with because they've already been through that, they've already gotten that training through previous careers. And so there's a trade-off, right? So you may have to spend more time with a younger employee doing X, Y, and Z, and more time with an older employee doing X, Y, and Z. But the reality is we can't make assumptions about either one of them. And we do. I mean, we absolutely do. This last story I'll leave you with. we were talking to the editorial news director for a TV station, and this came up somehow, the employment piece, and she said, well, I can't afford older workers. And, again, therein lies an assumption that tells us, she's sort of probably passing over older workers, assuming that she can. And the question is, well, the best practice is to publish your salary. And if there's a lot of stuff written out there about it. And if an older person applies for the job with a published salary, then they're going to take it. Or that salary is in their wheelhouse, but that's good for younger people too. And that younger people are just as apt to have an idea in their head what they want to make, and they think they're going to make it, and then you are going to tell them, well, this is it. Then they may not take the job either. So it's it's sort of thinking about best practices that works for everybody.
This was great. I really enjoyed your presentation, and I really enjoyed this discussion and conversation. So Jess and Dawn, thank you both very much for your time, for being here. I want to thank everybody who attended today's session. Please don't forget to complete the evaluation using the feedback button. And just two quick reminders. We now have a 20-minute physical activity break. We really hope you're able to spend a little bit of time outside getting some fresh air, stretching your legs, moving around a bit. And if you need some movement ideas, Ellen Thorne from the Healthy Community Coalition of Greater Franklin County generously contributed to the conference by providing some physical activity movement slides that will play after this session. And we will come back here at 1:30, and I'll be giving some updates about NPHA, and then we'll be joined by Director Shah, who will be giving some updates from Maine CDC. So again, thank you to Jess and Dawn, and thanks to everyone else for being here. We'll see you soon.